less is going to be nearly impossible. My name is Squire. I work for the Ohio State University Medical Center. I'm here to talk a little bit about how we can use social anything to do personalized healthcare. I think the basic idea is let's just change healthcare, period, because it's broken. So, first thing we're looking at is how broken is it really? The problem is medicine today is really reactive. It doesn't predict anything. You have to get sick before we take care of you. And that creates all sorts of cost issues and everything else. And that's what we're dealing with. You can see that the United States has outspent just about every other country in the world on healthcare. And this isn't a good thing, because if you look inside our own boundaries, in our own states, there is a disproportionate relationship between spending and outcomes. So you can't read this, I don't think. Basically, Ohio's in the bottom half, and we spend, more than double some of the people that are at the top. Healthcare is broken. You're going to die. We know that. The difference here is that you're going to die faster than people in these other nations that aren't spending as much money to keep you alive. That's not good. So as we move to a new kind of medicine, we realize that people can't even get it. They don't have access to care. That's one of the things that the federal government obviously was working on, but 1 in 4 people not getting access is not a good thing for medicine. The trend and the problem with what we have today is that is chronic disease. So obesity, diabetes, heart disease. We have all these chronic diseases, all these reasons people get sick and stay sick, and it costs us trillions of dollars to take care of it. Some trends going on in the environment that you need to know about. You guys know a lot about consumerism, so I'll tell you about systems biology. It's the idea that basically, I don't know anything about biology, it's basically the idea that all these different systems around you interact with your person, your system, and that's what keeps you sick or healthy. So all these systems, and here's some of them that you interact with. People are online, they're looking for health information, and they're looking to their networks to find health information. What they're not looking at anymore, or as frequently, is their doctor, their physician. The reason for that is because the physicians aren't available. They're behind the doors, they're on pedestals, and they're unavailable, so the doctors become the second opinion. When you look at the trend and where this is heading, text messaging among 12 to 17-year-olds is the #1 way they communicate with each other and with the family. They're not going to be able to text message their doctors, and so all our teens today are just going to die. Unless you change medicine. So we're looking at this idea of P4 medicine. P4 medicine takes into account predictive measures that look at your genetic makeup, preventative then based on your genetic makeup, so that we can keep you healthy. Personalized, which really is the idea that we look at those genes and make fixes for you based on those. And participatory, which is what everybody wants, but so far we can't really offer to. Genetics is a big deal with all of this. I look at our system right now and talk about a 20-minute meltdown. You get, on average, 20 minutes when you're healthy. So we get to keep you healthy in 20 minutes. Francis Collins said that, and he's now the director of the National Institute of Health. Pretty smart guy. What happens with participatory medicine is that you, the patient, want to be involved in this, and you have this, you have your personal health records, you're understanding genetics better. We have home monitoring devices, Nike with their new one today. And we know that mobile devices drive your participation in your own health care. The problem is, our physicians aren't there to help you at this point. And so what we need is a system that is truly social in nature. Part of that is your responsibility, because you can ask some of these questions, to drive that participation. So ask them how they would describe their communication style. Force them for some of these answers. Part of it is my job, to make sure that they get that information out. Ultimately, the goal then is to do this, is to use social media to create the culture in our organization that helps understand who you are so that we can keep you healthy. And that's not a pitch, that's what we're building. We do that with the typical social media model by first listening and then responding to what you're saying. That response then creates some sort of influence between you and you with me. And at that point, when we have the two-way influence, then you're enlisted. And we're enlisted to make it healthy. The big problem, though, is that we need people in the middle. We need to close the gap between these human technology interactions and human interactions. That's how we do